But Dr. Mukherjee, what you are saying therefore brings me to the next question. You wrote so brilliantly on the history of cancer in the Emperor of All Maladies. Cancer was seen as the great enemy in a way at the time. What makes corona so different to cancer or any other medical challenge that mankind has been confronted with? This contagion that is spreading right across the world, crossing all boundaries. What makes corona so different to what we've seen of any virus also in the past?
Well, so there are two features that are particularly complicated, and there may be more than that, but there are two features. Feature number one, which is probably the most important and was recognized quite late, is that asymptomatic carriers can carry the virus and spread it. That means that or pre-symptomatic carriers. In other words, you may feel completely fine, but you may be spreading the virus. This is very unique. This is not the case, for instance, for corona's cousin called SARS. It's not the case, as far as we know, for corona's cousin, another cousin called MERS, both of which are very dangerous viruses. The lethality of SARS is actually much greater than the lethality of corona. So that's one feature. And the second one is exactly what I just talked about, is that if you don't have any protection, the so-called R naught of the virus, the number of people that you can infect if you are a real viral carrier, is very large. Now, even within that, there are some people that we're now identifying called super spreaders. And we don't know why, but their viral load, as well as the amount of viral load that they're expelling into the world, is actually even an exponent higher than the others. So these two features, I mean, we can keep on talking more and more about corona, but these two features are really unique about this virus and make it very hard to contain, because if you're not sick but you're still spreading the virus, you won't know whether to put yourself into quarantine, whether to isolate yourself, and how many people you exposed.
You know, the reason I'm asking you this, Dr. Mukherjee, is because various theories are doing the rounds, and I'm still trying to understand, does the medical world really know what is the pathogenesis of this virus? Does it affect young or old, asymptomatic or symptomatic? Warm countries are better equipped to confront the viral than milder temperature countries. Do we really know what this enemy called corona is yet?
So the answer is we know little bits of it. We don't know all the information, but we know little bits of the information. Well, we know some of the patterns. We know that young people seem to have a milder disease, but let it be said that there are plenty of people in their 20s and 30s who have died from coronavirus. So although young people tend to have a milder version of the disease, for reasons that we really don't know, some young people have a very, very severe version of the disease. We heard of a young British nurse yesterday or day before yesterday, 25, 26 years old, who passed away, having been on a ventilator. We know that older people are more susceptible. We know that if you have a pre-existing condition, including obesity, diabetes, immunosuppression, cancer, especially cancer patients who are receiving chemotherapy for their other cancers and are immune suppressed, they have a very high rate of severe illness. We know a lot about the virus. We now know the sequence of the virus. We know how many genes it makes. We know what the virus looks like. There are microscopic studies, and we know potential places that we'll come to drugs in a second, but we know potential places to attack the virus and a potential place to make a vaccine against the virus. But these take time. All of these things that have taken time. We have done this in truly record speed, faster than anything that I can remember. So we know a lot about the virus. We know a lot of features of the virus, but there are many things that are unknown.